Okay, going through my site. The only thing that I will be using today is this as my MAR. Alright. So you can see me. The patient's takes rights of medication is patient medication time, route, dose, and documentation. Alright. Effie Smith. So I'm gonna go pull out her medication. She's gonna be taking insulin detamir, 12 units, twice a day, 12 hours apart, checking the expiration date. Along with that, against the MAR. Expiration date is good. I have the right patient. It's going to be a subcutaneous injection. And I have the correct time, 14:30. Alright. Insulin detamir. Okay. Hello, I'm Nurse Avery. May I have your name and date of birth, please? Okay. Boom, scanned it. Now it's going into the MAR. Alright. And now I'm just going to double check that to make sure that I do have the right medication and patient. So I'm going to look against the MAR. I have the right patient. I have the right route. Okay. And the expiration date is good. Okay. So today I'm going to be giving your insulin for your diabetes mellitus 2. So the generic name of the medication that you're going to be receiving is insulin detamir, and the brand name is Levemir, and this is to maintain your blood glucose. Some contradictions and interactions of this medication is if you're allergic to insulin detamir and its components. Also, if you have hypoglycemia, which is low potassium. Side effects of this medication can be hypoglycemia, which is and anxiety and headaches. I just want you to make sure that you avoid driving only if your blood pressure is running low, or also if it's too high. I also want you to avoid drinking because it can actually spike your sugars. And the dose that you're going to be receiving is 12 units. But I want you to know that you're going to be taking it twice a day, 12 hours apart. And before we get started, I just want to educate you on like the locations where you can put the medication. So you can do your upper outer arm. You can also do your abdomen, and you can also do your thighs right here, and then you can also do your buttocks at the top. You want to make sure that you're using a clean needle every single time. You want to rotate injection sites to prevent edema, inflammation, and swelling and tenderness. Yeah, so do you have any questions about what's going to happen? Alright, okay. So, what I'll do is perform hand hygiene. I'm going to check against the MAR just to make sure that I have the correct medication again. Insulin detamir, 12 units. Expiration date. Right patient, of course. And it is good. I'm going to scan the medication. Boom. Now it's going into the MAR. I'm going to try to set you down. Okay, like I said, I just performed hand hygiene. I would be wearing gloves. At this point, I don't have gloves, so I can't put on gloves. Right here, like that. So, I would take out my medication. I don't know if we're supposed to be allowed to use a vial or not, but what I would do is I would take this off, take off the safety, place it to the side, and I'm going to inject, well, not inject, I'm going to pull up 12 units to inject air. And actually, I'm going to go up a little bit farther, 12 units. Okay, so now if I had my ampoule or vial, I'm just going to take it like this. Oh, sorry. Take it like this, and then I'm going to stick it in there. I'm going to inject all of the air out like so. Now I'm going to take the ampoule and the vial. I'm going to flip it up like this, and then while holding it, of course, I'm going to go a little bit past 12 units just to ensure. Alright, and if there's any air bubbles, I would just flick it like so they can rise up to the top. I'm going to inject a little bit of air, if there is any, out until I get exactly to 12 units, like so, like that. Okay, so now that I know that I have that, I'm going to take my swab. I'm going to clean the injection site. This is the upper outer arm. Clean the injection site around a 2-inch radius. Okay, so then what I'm going to do is I'm going to pinch the skin like that, if you can see. And I'm going to go in at a 45 to 90 degree angle. Like that. Going to put the medication like that. I'm going to take my wipe. Slight pressure. Okay. After that, I'm going to take my syringe. I'm going to do the 1 scoop method. Alright. And I would put on the syringe safety, but mine's broken. It came broken, so I'm going to do that. I'm going to get up. I'm going to place it into the sharps container immediately. I'm not going to leave it out because that's how errors happen. Like so. Then I'm going to document exactly how much I gave the patient, and I'm going to, so after I get done documenting, I'm going to sit around for about, just for a few minutes just to make sure that she doesn't have an allergic reaction right away, edema, swelling, inflammation, make sure that she's still breathing, and things like that. And then after I'm done, I'm going to clean up my mess, and then I'm going to leave. I'm going to come back within 15 to 30 minutes just to ensure that, she doesn't have any edema, inflammation, swelling. She may have a little bit of tenderness from the spot, which is completely normal. And yes, that's what I would do. Now, for the child, Noah Rogers, I would do the exact same thing. I would clean the spot, I would check the MAR, expiration date, I would do the whole 9 yards, I would check everything, because on here it just has a verbalized location for injection, and I would also do the deltoid muscle. I would clean off the area, and you're supposed to use a 5/8 of an inch to 1 inch, but he seems like a smaller kid, so I'll probably use 5/8 of an inch needle, and then I would just put it on the deltoid muscle right here, and then I would just put it in at a 45 degree angle, and I would do the same thing. I would check on him, I would documentate. Yes, so that's exactly what I would do for the child and for Effie. Alright, thank you very much.